Actually, it's midday sleep and the effects on blood pressure in hypertensive patients. The thing is that we know very well that lifestyle changes represent the cornerstone of treatment in arterial hypertension, and when we are talking about lifestyle changes, we are referring to weight loss, physical activity, smoke cessation, of course, salt and alcohol reduction. But we do know that several subjects, and especially the elders, actually they want to sleep during midday. They think that it's beneficial, they don't know why. However, we don't have enough of studies assessing this issue. There is one study that found that midday sleep practically decreased in healthy subjects the relative risk of coronary death for about 12%. And for this purpose, we thought to investigate the effect of blood pressure, of midday sleep on blood pressure in patients with arterial hypertension. We prospectively studied approximately 400 patients, 386. And in all those patients, several measurements, office blood pressure measurement, 24 hours, ambulatory blood pressure measurement, pulse wave velocity, and full echocardiographic assessment was performed. And we saw that practically patients who had the habit to sleep during midday presented lower levels of pulse wave velocity, lower left atrium diameter, lower morning, daytime, and nighttime systolic blood pressure, and of course average systolic 24-hour systolic blood pressure. And there was also a trend for increased percentage of dipping status and less drugs in terms of number, because we wanted to investigate if midday sleep it's a habit, it's a custom, or it's also beneficial. So we saw that practically patients that slept during midday had on average 6 millimeters of mercury lower in 24 hours systolic blood pressure. And of course, this decrease may seem little. However, we do know that reductions as small as 2 millimeters of mercury may decrease the relative risk of cardiovascular events by up to 10%. So, this 6 millimeters of mercury, it's in terms of prognosis, it's very important. And we also observed that the duration of midday sleep was highly associated with the drop in systolic blood pressure and with the increase of dipping status, and practically 60 minutes of midday sleep in those patients were corresponding to 4 millimeters of mercury in the average of 24 hours systolic blood pressure drop, and the increase in dipping status for about 2%. And we conclude with the fact that midday sleep actually decreases systolic blood pressure levels in patients with arterial hypertension and may enhance the dipping status in those patients. First of all, we have to see if it works, because it's a small study, but it seems logical that midday sleep decreases average systolic blood pressure. Well, of course, it's a privilege nowadays to sleep during midday due to the intense workload. However, a lot of elders doesn't work. If they have the chance to sleep and it's beneficial, why not sleep during midday? The decrease of blood pressure is substantial, and of course the benefit from the decrease of blood pressure is there. So the thing is, and then the question is, midday sleep should be included in the lifestyle changes. This is the question that we have to answer. Approximately 386 hypertensive patients, and this study lasted for about 5 months, but we want to continue because we want to include also other patients with uncontrolled or untreated hypertension, but also healthy subjects, to see how blood pressure behaves also in healthy subjects. We have to see the results, and if the results are good, we have to publicate in order to everyone knows the effects of midday sleep. This was an observation study. We didn't tell them to sleep or not to sleep because practically it's very difficult to put someone to sleep and another one not to sleep. It was not randomized, but you can randomize someone to sleep or not to sleep, and there is no sleep placebo to administrate. Actually, we observed patients who slept during midday and patients who didn't sleep during midday, and we saw the differences. In this case, if the things go well in terms of blood pressure reduction in a large sample, we could suggest to patients if they have the time to sleep during midday, because also these 6 millimeters of mercury of drop of systolic blood pressure is important. Well, actually, lifestyle changes represent the first step of treatment in patients with arterial hypertension. The drugs can be added or not, or can be added after several weeks. This depends from the total cardiovascular risk of the patients. If a patient had arterial hypertension flow stage and a low cardiovascular risk, we could even wait for several weeks before start treatment and start the lifestyle changes. And this is valid also for our case.